Costa Rica healthcare. Affordable, reliable, and honestly, way less traumatizing than a trip to the ER back in the US. But before you move down here thinking it's all house calls and jungle cures, let's talk about how the system actually works. There are two main players: Caja, aka the public system, and private healthcare. A lot of expats use both, so let's break them both down. Caja is Costa Rica's universal healthcare system. If you become a resident, you're required to join. Those payments can run anywhere from $75 to $450 a month, depending on your income. That covers doctor visits, hospitals, preventative care, prescriptions, but there's a catch. It's not Amazon Prime. Appointments can sometimes take a while to get, and facilities can often feel crowded. But it's a solid choice for chronic care, emergencies, free or really cheap prescriptions, and affordability. Think of it as that dependable minivan that always gets you there, just maybe not on time. Private care is where Costa Rica really shines for expats. Modern facilities, English speaking doctors, many trained in the US or Europe, and the kind of wait times that don't make you question your will to live. The costs? A specialist visit can run anywhere from $80 to $120. ER visits are often under $300. And private insurance itself is about $100 to $300 a month, depending on your age and the coverage you want. It's still a fraction of US prices. So basically, if Caja is the minivan, private care is the sporty convertible, flashy, fast, yet surprisingly affordable. A lot of expats go hybrid. Caja for the big stuff, emergencies and prescriptions, and private for quick fixes. It's the healthcare equivalent of ordering gallo pinto and pancakes. The best of both worlds. Also, pharmacies in Costa Rica are everywhere, even in smaller towns. Many medications are available without a prescription, some antibiotics, birth control, blood pressure medications, antidepressants, and the pharmacists are incredibly knowledgeable and helpful. Prices are often way lower than the US, but bring your prescriptions at first so you can compare and transition smoothly. A pro tip: ask your local pharmacia what's available. They'll often hand you a generic that costs a quarter of the price of what you're paying back home. Also, PICA also recognizes same-sex marriage and has anti-discrimination laws, so your spouse can be covered under your residency benefits and your insurance. And LGBTQ plus expats generally report respectful, affirming care, especially in cities and tourist hubs. This is where those LGBTQ Facebook groups for your area of Costa Rica can really help give you solid suggestions of doctors. So here's the takeaway. Costa Rican healthcare is affordable, reliable, world-class, and absolutely expat-friendly. Use Caja for the big stuff, private for speed, pharmacies for cheap meds, and you'll never even miss those $800 ER bills back in the US. So subscribe for next week's episode of Pura Vida Diaries, How to Be a Good Immigrant, aka Don't Be That Expat. Thanks, and I'll see you next time.